Hi everyone. So this is our 31 week update. I did not have a formal appointment because I had to work, and when I made my schedule, I didn't realize I had to work on a day I would normally make my appointment. So I kind of got squeezed in, snuck in the back door. Perks of knowing a doc personally, I guess. So everything looks fine, looks good. I've come to the conclusion that I sound like a fat golden retriever when I do anything, as you can see. So I'm dealing with that still. But I feel okay. I still feel all right. Baby is moving a whole lot. We finally have our birth order filed, is my understanding. And so all of that is finally taken care of. It was a small feat. I think I mentioned that before, to get this birth order taken care of. So yeah, everything looks good so far. He's growing, he's getting bigger, and he's really strong. I forgot how active they can be at this point in the game. I've got my tea. It's not coffee. I like my tea in the mornings. It's better. So everything looks good. Everything looks all right. We are starting to make plans for when we have to go to Las Vegas to deliver. The parents stated that they've got everything they need. They're just waiting on mom's visa to come over and get her little boy, and then they'll have a more firm date about when they will arrive in the States. It looks good. Some super exciting news this week is that I have hired a birth photographer. I'm so excited. I didn't get to do this with my own kids, and before anybody goes put me on blast, I did not hire them for myself. I think it's really important that these people get a chance to see themselves become parents and not have to worry about taking pictures and paperwork or whatever else. The mom is really into pictures. She really likes pictures, and I don't want her to have to worry about that. I want her just to focus on her son and, him focus on his son, and just seeing their little boy and getting to hold him and not having to worry about taking these pictures all the time and documenting it, because it's so important. And so a friend of mine who is a newborn senior photos family photographer in Las Vegas. I used to work with her at one of the hospitals. Look her up. She's amazing. Her name is Little Lou, Loo, photography on Facebook. Is venturing out into birth photography. And she's starting to put a portfolio together. So I've talked to her, I've reached out to her, and praying that timing works out and everything looks good. But she says right now everything looks like it's going to be perfect. So we're going to have a lot of pictures of me and them meeting, and them coming to doctor's appointments, and then the actual delivery. So it'll be well, not the actual delivery because, but them becoming parents at the actual delivery. And I've talked to her, and we're going to really focus. We want it to really focus on them becoming parents, not me giving birth, but them becoming parents, and then her following them to the nursery so they can have some private time with their son, and them just enjoying their child. So, and they'll get to take that home with them, which I think is really exciting. So they don't have to worry about it now. I am so excited about this because I love her work. I've seen this woman do everything from boudoir shoots to newborns to families, like I said, in senior pics, to just like playful themed shoots with her friends and family. She did one with her daughter a couple years ago that was a time traveler. It was just amazing. She's so good. Yeah, so I'm so excited about this. I cannot wait to get this on film for them, because I have been looking for something to give them to commemorate this, so that they will have something to remember all this by. And I know they have their baby, but a way to say thank you, because they keep telling me thank you and telling me thank you, and you've done, we love you so much for doing this for us, and I don't know how to tell them back that they've done just as much for us, and so I want something they can remember, something that was gonna be special for them. I got some little onesies. I don't know where I put them. Some little onesies. The dad's real into Harley Davidsons, and I guess it's kind of a big deal in China because they're American-made motorcycles. But they're like a huge deal in China. So there's like little Harley biker groups or whatever. But I'm gonna make him, because I'm set up to. I have like a home-based business where I can do stuff like that, and I'm gonna set up a little onesie and make them a little onesie that has Harley Davidson all over it, probably a little Harley on the bottom. So, and one of the girls at work said that she's gonna make a blanket, and I told her a Harley blanket would be awesome. So. So that the dad feels included, but I wanted something really special for them that they could remember this day, like actually remember and see it. So I'm really excited about that, because I just can't tell them thank you enough, because they've helped us so much. I mean, excuse me, you guys, I'm sorry about the burping all the time, the whole time. You know, we as surrogates put ourselves out there so much, and we put our body through so much. Excuse me. To do this, and we go through fertility treatments, and we go through this embryo transfer, and we carry this baby for 9 months, and we feel it move, and we don't get attached for them. I mean, I don't know of any surrogate who feels the same way about her surrogate pregnancy, that felt the same way about her surrogate pregnancy as she did about her own. And but we do this, and our families suffer a little bit, and our spouses are like, oh my God, sometimes, like my husband's like, you know. And so let me fix this. That's better. And so it's, you know, but we give a lot of ourselves, and so I understand the parents are always so thankful, but sometimes I think people, they know, but I think they forget that sometimes our gain from this, that compensation, is just as helpful. I mean, for us, I didn't go into this for money at all. I've wanted to do this for a really long time, since I was 17, since I had my daughter. And excuse me, the compensation was just an added bonus. But that compensation has helped so much in ours. I mean, we had a roof leak, and we've been trying to figure out how we were going to get it fixed. We had our whole roof redone with 2 months checks. I mean, that come, so it was nice. I mean, those are little things that aren't like detrimental to our life, but it takes the ease off of us. We've paid off a lot of credit card debt, and I mean, there's just so much that it's done for us. And I've been trying to think of a way to tell them thank you, because I don't think they really understand how much this has helped us as well. It was a win-win, you know. And I just feel like it would be so rude to tell them, or make me look like maybe we weren't financially stable or something. And so this is my way of saying thank you, I guess, back, so that they know that this is about them. And I don't know, it's just hard. It's hard to talk about money. I don't like to talk about money, so it's hard, yeah. But yeah, I'm excited about the birth photographer. I'm really excited about it, so I don't know, we'll see. Maybe there'll be you guys will get some pictures of that when I get them, so it'll be exciting. All right, until next time, I have an appointment in a week and a half. It's a week from today, actually, I believe. So a week. I have an appointment in a week. 32 weeks on Wednesday. It's Monday now, and that's all I got. I got nothing else. So until next time, see you then. Hi everyone. It's very early in the morning, and I'm getting ready for work, so I'm gonna flat iron my hair while I did this little update. I am 32 and 3 weeks today, and I am finding it more difficult to sleep at night and to be comfortable. And tonight was my first night that I had cramps. And when I say cramps, I don't mean like labor cramps. I mean leg cramps. Raise your hand if you ever had a leg cramp while you're pregnant. I got these horrifically with my son, my 12-year-old. It was my first pregnancy that I'd had them with before, and I just remember being in excruciating pain. I seem to only get them at night when I'm sleeping. At least I did with him, and he, they were uncomfortable. They were really uncomfortable. They would wake me up out of a dead sleep, and my whole leg felt like it was seizing up. And tonight, I woke up twice, one in each leg at different times. With my son, I feel like they were mostly isolated to my right calf. Holy crap. I could not get these to stop last night. It took me a good 5 minutes of trying to unclench, like consciously think about the the the, the calf and get it to and get it to relax and get it to uncramp, I guess. I don't really know. It just, the whole calf froze up and it pulled my heel up towards my like it made me point my toe. That's what I'm trying to say. And I just could not. It was horrifically uncomfortable. I know there's a way to make it feel better, and I know there's a way to prevent them, but I, for the life of me, cannot remember what it is. And I feel like Google is failing me right now. It might just be ginger brain, but yeah, I'm not 100% what to do here. So if I'm here doing this video, asking for advice from anybody else who's had leg cramps, because oh my goodness, I just could not do it. I mean, first it was my right leg, and then I finally got that to relax, and then I woke up a little bit later with my left leg doing the same, and my left leg is still a little sore from it. My left leg was so much worse. So I got nothing. My doctor's appointment is until next week, and I feel like I bug my docs at work so much about stuff, and I text them so much. It's one of the perks / guilty moments of knowing your doctor's on a more than just a patient doctor visit basis. So if anybody has any suggestions, dear God, please let me know, because I can't do that again. I'm loaded. All right, I will see you guys soon. Thanks for the advice in advance.
All right. I feel like all I do is complain this goddamn pregnancy. Jesus Christ. Excuse my language. Good Lord. You guys, this sciatic pain is god awful. Legitimately, I feel like I can't walk at some points. Like my entire leg goes numb. My husband refused to go with me to the store today. It is horrible, and there's like no trigger to it. It just happens. I have been sitting for 2.5 hours. I just drove to Vegas, and I was fine in the grocery store a few minutes ago, but walking to the house just now, I mean, I can't even stand to put pants on because I have to put weight on one leg. It makes my whole leg go numb. Oh God. I'm telling you, I can't. I need him to move. I need it to stop. There has to be something that's going to make it stop. My husband said maybe I should go to the chiropractor, which is what I've heard from a couple of girls at chiropractor, but some said it worked and some said it didn't. So, oh my God, I'm serious. Any tips you guys have, anything you can tell me, anything you guys can give, I got nothing, because I have not had to deal with this ever in my whole entire life, and I'm just gonna want to cut my leg off. Please, any advice you guys can give, please. Good evening, everyone. Okay, so we are 33 and 5 days today. I had my 33-week appointment last week, and he said everything looks good. Says the baby looks fine. I'm measuring right on schedule. I addressed with him the sciatic pain, and he basically told me that this is pregnancy. I told him I have a little bit more trouble understanding why this one is just physically a little bit more uncomfortable, and he said, this is just pregnancy for you at this age. So basically I'm old. Yeah, so he gave me some tools, or at least some suggestions, not some tools, to help relieve some of the sciatic pain, because sometimes it's really uncomfortable. Like my leg will go numb, and it makes my leg almost give out, and it's hard to bear weight on it. Like I feel like my leg is gonna not hold me up. So he said basically repositioning. He said baby's probably just sitting a lot lower, and I do feel like this baby is a lot lower than my children were at this gestational age. My children were all the way up in my diaphragm, it felt like, and there's a lot of space between my chest, like my rib cage, and where the baby's at this point. But he said probably just baby's lower, so it's basically just his positioning same stuff I found on the internet. You know, lay on the side that makes it most comfortable and try to relieve that pressure. But he also said just like warm baths, floating, getting in the pool. It's too cold to get in the pool now, but he says if you've got a jacuzzi, then sit in the jacuzzi for a little while. If not, in a tub. So that's what I did, and I felt a lot better. So that was nice to have one night where my butt cheek wasn't numb. I also discussed with him, I'm so sorry, discussed with him the Braxton Hicks, and I think I addressed that before. I did not have Braxton Hicks with my children at all. I had one episode of preterm labor-ish stuff with my middle boy, but it was due to a kidney infection, so it was secondary to a kidney infection, and it triggered some contractions and some irritability. They treated me for it, went away, never had any issues, didn't have any problems with my cervix, nothing like that. I, this time though, have a lot of tightening in my stomach, and it's been going on for, probably since I was like pre-viable, like before 20 weeks. When I would work out though, I would mostly get it, and I assumed it was because I was engaging my core, so I tried to adjust how I was working out, didn't make it stop, made me a little bit nervous, and then the whole like you can't breathe because you sound like a big fat cow thing started getting worse, and so I kind of just gave up exercise, unfortunately, which you can see in my little waddle right here. Because it's just not worth it at this point to put myself in a position where I can't breathe properly and I feel like I'm going to pass out. So, but the like tightening has not gone away, and it still comes. Sometimes it's very regular, sometimes it's not. Nothing really triggers it, nothing really makes it stop. There's no rhyme or reason to it. So my logical brain says they have to be Braxton Hicks, but my non-logical brain goes, sometimes they are really, really uncomfortable. Like, holy crap, and they're like a good 2 minutes long, and sometimes they're regular, whereas like you can feel them, like when you touch my belly is hard when you touch it, and I've told him, I said I feel like it's pulling everything down from my chest into my stomach, like pulling everything down, and then at the same time pulling everything up down from my downstairs, and it's uncomfortable. It seems to be slightly more regular when I get upset. For instance, my 15-year-old was being a complete douche hat the other day, and I was yelling at him, and I got all worked up, and that just all took to set it off, and it did. So I laid down, drank some water. I talked to my OB nurse best friend, and she was like, you need to lay down and drink some water. She was probably Braxton Hicks. I did not end up going in because laying down and drinking some water made me feel better. But I expressed all this to my physician, and he thinks it's best to get a cervical length. So I think my 36-week appointment is when it was scheduled. So it's 3 weeks away. He said if it continues, we'll do it. We're going to do a cervical length, which is basically that big wand thing they stick in you. So we get to go through that again, which is so much fun. Excuse me, because we don't do enough hoo-ha scans in the beginning of this surrogacy. But just to be sure, I did check myself. I don't encourage that if you don't know what you're looking for, especially if you don't wash your hands regularly. But I did check myself. My cervix is not opening. The outer opening is like a 1 to 2, which is completely normal for somebody who's had a bunch of babies. But the inside was closed, so I'm good there. But he's gonna check. He wants to check it anyway. So I guess that's what we're gonna do. Other than that, I got no news. My parents are awaiting mom's visa, so we will have a more definitive date after she gets her visa about when they'll be over, and then we can start planning when we're gonna meet up with the birth photographer and all that good stuff. So I'm excited. It's almost here. I can't believe I'm gonna be 34 weeks. I feel like this flew by, you guys. I feel like it was just like, bam, done. What happened the whole year? I'm getting a little bit more nervous about delivery. Like, the more I think about it, the more nervous I am getting. Oh, you know what? Speaking of delivery, I have every intention of going natural. I have told my doctor I don't want to be induced. I did not get epidurals with my other kids. I did get some IV pain medication early on in labor, but that won't be happening this time. And I just want to say, for you girls, for anybody who makes their own choices about how you manage your pain and how you labor, good on you. Don't you let anybody make you feel like shit about it. I had one of the nurses at work this week. Somehow we were discussing birth options and whatnots, and I said something about being natural and about no pain medication and whatnot. And she laughed at me out loud and made a scene at the desk and proceeded to announce to everybody at the desk as loud as she could that I was going to go natural. And then she proceeded to tell me that there was no way I was going to go natural, that I would be begging for an epidural by 4 centimeters, that I would never make it. Despite me looking at her and going, okay, I did it with my other 3. I'll be fine. Yeah, right. Are you guys hearing this? She thinks she's gonna go natural. Made a huge scene about it. Now, that's what's right for me. What's right for you and what's right for her, that's your own beeswax. But if you decide to get an epidural, if you decide to go natural, if you decide to dope yourself up with some IV pain medication, you know what? That's your choice. That is your choice. And it was just kind of funny because it came at the tail end of something I had seen in one of the surrogacy groups about one of the girls who is caring for another family stated that she labors naturally. I shouldn't say naturally, unmedicated. She labors unmedicated, and she is usually very vocal when she labors, and she's worried about offending the parents of the baby, and wonders if maybe it would be better to have them not be in there while she's laboring, and that sparked a whole different discussion. But somebody implied that, did she discuss those options with the parents? Because they may be uncomfortable with her laboring naturally, and like implying almost that it was dangerous or something to that effect. And I just I could not wrap my head around it. I don't think that anybody comes into surrogacy with a knowledge base that is astounding about what's gonna happen. You guys, I'm so sorry. But we all usually have a pretty good idea about how labor and delivery works, I would imagine. I mean, we've all been through it at least once, right? But I couldn't really get my head around this implication that would it be safe? How would not having medication in your body not be safe? How would following evidence-based practice not be safe? How would being allowed to move during labor not be safe? There's very few situations where you really need to stay in bed, and those few situations are few. Like, you have an epidural. Don't get out of bed with an epidural, you guys. It's not gonna be good news. Excuse me. You have some type of medical emergency going on, meaning you're not stable. My goodness, you're not stable. You have some type of vaginal bleeding that's unexplained, a cord prolapse. But those are like, holy shit, she needs to move back to the OR emergencies, usually, those last 2. I mean, those are going to be, yeah, you need to be in bed. I mean, even your water breaking does not mean you have to stay in bed. So I can't wrap my head around this thought that an unmedicated birth is an unsafe birth. There's something I was taught anyway in nursing school. Every time we add something to you, it increases your risk for intervention. We put an IV in you, increases your risk for intervention. We give you an epidural, increases your risk for intervention. We give you medication, increases your risk for intervention. What type of intervention? It depends on reaction or the side effect or whatever it may be, but I just can't wrap my head around that. And it was just real coincidental that I just read this the other day, and then this nurse had kind of basically made fun of me for thinking that I was going to go unmedicated. So more power to you, ladies. I mean, keep doing it. Keep doing your research if you don't know, and pay attention. Evidence-based practice is so important, and it's becoming much more mainstream, and understanding evidence-based practice is becoming easier. It used to be very secret, and the docs didn't share the information and the nurses didn't share the information, but now there are so many patient advocacy groups out there, and now instead of the doctors pontificating at the nurses and the patients, it's encouraged to be a multidisciplinary team where the patient is the lead of that team. So, if you guys have questions about things, you can drop them in the comments and I will try to give you links. But do your research. Pay attention to where you're getting your information from. Information's from ACOG, from CDC, from .edu sites, medical school sites, Johns Hopkins, I can't say it. You know what I mean. Those type of sites are usually very reputable, and they usually are where our research is coming from. Look at when you're online and you're looking at articles, make sure they're peer reviewed. ACOG just came out with new guidelines on VBACing, which to me I feel like isn't really a big update, but the birthing community feels like it's a huge update, because to me VBAC is just a normal thing that happens. I can't tell you how many VBACs we've done, but it's important information, because guess what? Vaginal birth is the preferred method of delivery over cesarean, even if it's a secondary cesarean. There's situations where you can't VBAC, like if you have a classical incision or a vertical incision. But for the majority of patients in America, we don't use those incisions. Oh, sorry. That was such an ugly face. But pay attention, ask questions, talk to your physician. Remember, you always have the right to refuse things. So, if you guys have questions or you want to just talk about it, let me know, and we'll do a whole video on it, because I got all kinds of information about that. So, I will see you guys next time. So I probably won't update for a couple weeks. Bye, guys.